The clearest evidence we have is that wildfire smoke exposure exacerbates respiratory disease, most clearly with asthma. Almost every study that's investigated has found that air pollution, really high air pollution from wildfires, is associated with increased hospitalizations and emergency department visits and physician visits for asthma. Similarly, for chronic obstructive pulmonary disease, called COPD, we also see growing evidence of exacerbation of COPD from wildfire smoke exposure, and we also see increased evidence for respiratory infections such as bronchitis and pneumonia. With cardiovascular disease, for a while we were not seeing evidence of an association with wildfire smoke. However, some recent studies have found significant associations, particularly for out-of-hospital cardiac arrests and for a few studies for a few fires for other health endpoints such as stroke and ischemic heart disease. At this point in time, it's hard to say if there's a difference in magnitude between the respiratory risk and the cardiovascular risks, mostly because so many studies have found no association between wildfire smoke exposure and cardiovascular risk. Of those that have found relationships with cardiovascular disease, the risks are on par, similar increases in risk for the same amount of increase in air pollution. But stay tuned. As more studies find evidence of cardiovascular risk, we might find differences in magnitude. I'm asked that question a lot, and unfortunately at this point in time, the answer is we don't know. There have been very few studies that have been able to discern the impact of these acute, very high air pollution exposures that come from wildfire smoke on health impacts down the road. There is one study that from Indonesia where they were able to look 10 years later and attribute declines in lung function, particularly among adult males, to this very high air pollution exposure that they had during the 1997 Indonesian wildfires. However, that's just one study, and we definitely need to study it in other places with other fire episodes. Again, here there's been very few studies specifically focused on wildfire smoke exposure. However, there's a large and growing literature on air pollution from other sources and its impact on babies in utero, newborn infants, and young children. Of the wildfire-specific studies, I was part of a study where we investigated babies that whose gestation intersected with a wildfire episode compared to babies that were conceived after or delivered before the fires in an air basin that was heavily impacted by wildfires. It was the Los Angeles air basin during the 2003 fires there, and we did find a significant decline in birth weight. It was very, very small. However, for babies that are close to the borderline between a clinically relevant measure of what's termed low birth weight versus not low birth weight, we know can have lifelong health impacts. But at this point in time, we need more studies that investigate this. And also, we need more studies looking at the early life exposures once the child is a newborn and how that impacts sort of the developing lung and just the developing body in general. In studies that look at young children, we're not so interested in cardiovascular disease with young children, but definitely asthma and respiratory infections are important. However, the studies that look at differentiating risk between adults and children, the results are very different study to study. And so we definitely need more research to understand that better. It could be that there's differences in the fire. It could be that parents are doing a good job and schools are doing a good job of making sure children are taking precautions during wildfires. And that might be why we're not seeing as much of an impact on young children. But at this point, we need more research to fully understand that.